Hello, everyone. Let's explore a futuristic patient hub, reinventing healthcare into a one-stop intelligent experience for patients. Imagine a world where navigating healthcare is as simple as ordering a ride, booking a flight, or managing your finances online. No fragmented portals, no repeated paperwork, no confusing bills, no disconnected apps, just one intelligent, secure, personalized platform that supports you from your first symptom to long-term care management. That is the vision of the futuristic Patient Hub app. Today, healthcare is digitally advanced but deeply fragmented. Patients interact with multiple portals for scheduling, insurance verification, lab results, prescriptions, education, telehealth, billing, and remote monitoring. Each system may work on its own, but together they create friction. Hospitals struggle with access bottlenecks, rising consumer expectations, health inequities, staff burnout, and poor adherence rates. Digital tools exist, yet they are siloed. Data exists, yet it is disconnected. Patients exist in between these systems, forced to navigate complexity on their own. Now imagine something different, a unified, intelligent digital front door that orchestrates the entire patient journey end to end. From awareness and triage to diagnosis, treatment, recovery, and lifelong management, one ecosystem, one experience, one source of truth. This is the futuristic Patient Hub. At its core, the Patient Hub is not just an app, it is a governed digital health experience platform. It unifies access, scheduling, insurance verification, digital intake, education, affordability support, adherence programs, communication, navigation, and remote engagement into a single environment. Let us break down how it works. The journey begins before the hospital visit. A patient opens the app because they are experiencing symptoms. Instead of searching random websites, they interact with embedded generative AI that performs intelligent triage. The AI asks contextual questions in simple language. It adapts to literacy level, it supports multiple languages, it recognizes urgency signals. Based on responses, the system can recommend self-care, schedule a primary care visit, connect to telehealth, or escalate to urgent care. This reduces unnecessary emergency visits while preventing dangerous delays. Behind the scenes, the AI engine is not acting independently. It operates within clinical governance frameworks. It follows approved protocols. It logs explainable reasoning. Human oversight remains embedded into the system. Now the patient needs an appointment. Instead of calling multiple offices, the Patient Hub integrates directly with provider scheduling systems and electronic health records. Real-time availability is visible, insurance eligibility is verified automatically, copay estimates are displayed up front, financial assistance options are explained clearly, transparency reduces anxiety, it builds trust. Before the appointment, digital intake forms are auto-populated using existing records. The patient confirms or edits information rather than starting from scratch. Embedded AI simplifies complex medical terminology into understandable summaries. Educational content is personalized to the patient's condition, demographics, and risk profile. Accessibility is built in. Voice navigation supports elderly patients. Visual contrast modes assist those with visual impairments. Multilingual translation ensures inclusivity. At the facility, wayfinding becomes seamless. The app provides indoor navigation guidance, parking instructions, check-in prompts, and wait time updates. No more confusion in large hospital campuses. During care delivery, the platform does not disappear. It becomes a coordination engine. Clinical summaries, lab results, imaging reports, and care plans are released through governed workflows. Instead of raw data overwhelming the patient, generative AI translates findings into plain language explanations while clearly distinguishing informational support from medical advice. Medication instructions are personalized, side effects are explained clearly, alerts are triggered if a patient appears at risk for non-adherence. Now let us explore adherence and ongoing care. One of the biggest challenges in healthcare today is treatment non-adherence. Patients forget medications, they misunderstand instructions, they face affordability barriers, they lose motivation. The Patient Hub addresses this using predictive analytics. Integrated remote monitoring devices transmit vital signs. Digital biomarkers are ingested securely. Behavioral signals such as missed logins or skipped check-ins are analyzed. Machine learning models identify patients at risk for non-adherence or deterioration. Instead of waiting for complications, the system triggers proactive outreach. A nurse may receive an alert. The patient may receive a personalized message, a virtual visit may be suggested. Care becomes proactive rather than reactive. For chronic disease management, the platform connects wearable devices, home diagnostic tools, and symptom trackers. Data flows securely into the ecosystem. Physicians can view dashboards showing trends over time. Patients can visualize progress in simple graphs. This continuity across settings is critical. As highlighted in research on digital patient journeys, modern care extends beyond the physician's office and includes multiple digital touchpoints across diagnosis, treatment, and long-term management. The Patient Hub operationalizes this reality by unifying those touchpoints. Telehealth is fully embedded, not bolted on. Virtual consultations, secure messaging, remote second opinions, and care team collaboration happen inside the same environment. Importantly, the platform also integrates affordability and payer coordination. Insurance claim status can be tracked, prior authorizations are digitized, cost comparison tools are accessible, payment plans can be initiated seamlessly, healthcare becomes financially transparent and navigable. From a system architecture perspective, the Patient Hub is built on secure interoperability standards. It connects to electronic health records using modern APIs like FHIR. It integrates payer systems. It connects digital health tools and remote monitoring platforms. This interoperability is essential because lack of data integration remains one of the biggest barriers to digital health adoption. The Patient Hub is designed to solve this through open, governed integration layers. Security and privacy are foundational. Data encryption is applied at rest and in transit. Role-based access controls ensure appropriate data visibility. Audit logs maintain transparency. AI explainability layers document reasoning pathways. Trust is not optional in healthcare, it is mandatory. Let us now look at the intelligence layer more closely. Embedded generative AI performs several roles. First, it simplifies complexity. Medical documents, discharge summaries, and lab reports are translated into understandable language. Second, it personalizes engagement. Education adapts based on age, literacy, comorbidities, and cultural context. Third, it automates workflow, intake triage, appointment routing, follow-up reminders, and insurance verification becomes streamlined. Fourth, it predicts risk. Using historical data and real-time signals, it identifies gaps in care before they become emergencies. However, AI operates under governance. Clinical protocols guide responses. Human clinicians validate high-risk scenarios. Bias monitoring tools assess fairness across populations. Data minimization practices protect privacy. This is responsible AI in healthcare. Now, let us consider the broader ecosystem impact. Healthcare leaders globally are recognizing that digital innovation must span the entire patient journey, not just isolated touchpoints. The Patient Hub embodies that philosophy by connecting awareness, diagnosis, treatment, adherence, and continuous care into one orchestrated experience. For hospitals, the benefits are substantial: reduced call center load, improved appointment show rates, better patient satisfaction scores, lower readmissions, enhanced operational visibility. For clinicians, workflow friction decreases, information is centralized, communication channels are streamlined. For payers, data-driven engagement improves adherence and outcomes. Preventive interventions reduce long-term costs. For patients, the impact is transformative. Healthcare no longer feels like a maze, it feels guided. The platform also addresses health equity. Multilingual AI support reduces language barriers. Accessibility features support patients with disabilities. Predictive outreach identifies vulnerable populations who may otherwise fall through the cracks. Digital inclusion becomes part of the design, not an afterthought. The platform also addresses health equity. Multilingual AI support reduces language barriers. Let us envision a real scenario. A 52-year-old patient with hypertension logs into the app. Her wearable device syncs blood pressure readings daily. The system detects a rising trend. Medication refill is overdue. AI predicts elevated risk for non-adherence. She receives a gentle notification explaining the importance of consistent medication use. It offers to schedule a virtual consultation. It checks insurance coverage. It suggests nearby pharmacies with price comparison. A nurse care manager receives a dashboard alert. They review the data and initiate outreach. A potential hospitalization is prevented. Multiply this across thousands of patients, and the impact becomes systemic. This is not futuristic fantasy. The building blocks exist today: remote monitoring, interoperability APIs, generative AI, predictive analytics, cloud-based integration, digital triage, telehealth, secure messaging. The innovation lies in orchestration. Healthcare transformation is not about adding more apps, it is about unifying them into a governed, intelligent continuum. The Futuristic Patient Hub is the one-stop digital front door that transforms fragmented healthcare into a personalized, AI-enabled ecosystem of care. It moves healthcare from episodic to continuous, from reactive to proactive, from confusing to intuitive, from siloed to unified. It empowers patients, it supports clinicians, it strengthens health systems, and most importantly, it brings humanity back to healthcare by removing friction and restoring focus on what matters most: better health outcomes and better human experiences. Thank you for watching.